We're here at the 2016 ESMO conference in Copenhagen, Denmark, and I'm joined here with Wendy Yard from she is the Executive Director of the Association of European Cancer. Wendy, it's so good to see you.
Thank you very much. Thank you very much for giving me this opportunity and for being here.
Yeah. So Wendy, we've had a lot of meetings over the last couple of days really focused on the patient and advocacy. And I know a lot of the work that you do is around that area. And advocacy has changed so much over the last couple of years. And there are a couple of drivers for that. One is the new medications coming to market around immunotherapy, access to medication with biosimilars, really a focus here at the Congress. But what do you think some of these other drivers are that is really changing the face of advocacy?
Yeah, you're absolutely right. The face of advocacy has changed in terms of everyone now realize that the patient's voice is very important, and if we want to make a real change in advancing cancer control, we do need to incorporate the patient's voice, their thoughts, and their opinions in everything that we do. Now, my organization, the Association of European Cancer Leagues, we're based in Brussels, which not everyone around the world knows, but Brussels is really the Washington, D.C. of Europe. So by being there, we're actually in a very strategic geographic location to do advocacy and lobbying work. And therefore, we do a lot of work. With the European Parliament, at the European parliamentary level, with the members of the European Parliament, we do a lot of work with the European Commission. In fact, the European Commission has now asked us to disseminate a set of messages for potential cancer patients, but just really for the general population on how do you prevent cancer. There's so much you can do to reduce your cancer risk. And in producing these 12 messages, which is called the European Code Against Cancer, they also made sure that patients were involved in developing these messages so that they're understandable to the patients. Now, because I just mentioned that we work a lot with people, with the members of the European Parliament, we provide the secretariat for a group called the Members of the European Parliament Against Cancer. And these are the members of the European Parliament who are dedicated to making sure that cancer rests high on the agenda at the European Parliament level, but also at the national level. So both at the European level and the national level. And by providing the secretariat, we see that when we talk to the parliamentarians, we can see that things have changed, and they often do ask when we organize meetings, when we speak to stakeholders, to make sure that we do get the patient's voice in there. So when we organize roundtables and when we attend roundtables, we see over the years now more and more patients groups and advocacy groups are part of the roundtable discussions to make sure that whenever policies are being considered at the European Parliament level, regulations and directives, that their voices are heard. For example, we do a lot of work in the area of employment and cancer patients to make sure that they're not discriminated against because they had cancer previously, or they're just recovering from cancer. And we also try to improve the conditions for cancer patients so that they can get back to the workplace, but also that employers understand that and facilitate that they should, when they return to the workplace, to let them have the time off that they deserve, if they need that extra time to do follow-ups, and they should not be discriminated against that. So these are some of the work that we are very active in at the European parliamentary level.
So Wendy, one of the things that we're hearing about these days is access to information, and the internet is a great tool. Are you utilizing the internet and to get information out to the patient communities that you serve that might help you drive policy?
So we provide the secretariat for cancer societies from all over Europe, and our work related to patient support is via our cancer leagues who are at the national level, and it's all leagues at the national level who are looking after this because there's so much information out there, aren't there? And a lot of it is not, it could even be harmful for the patients. Right. So the cancer leagues at the national level, they try to inform, let the patients know that there are some harmful information out there, and that they could then guide them in how to go properly through the internet and get the advice and be advised properly on what to listen to and what not. So we do realize that this is a very important area, an issue for carers and for patients and for the general public. So at the next ECHO Congress, which is going to take place in Amsterdam, we are involved in organizing a session in the patient advocacy track specifically on this issue, and it's called Myths and Realities. And there we're going to be addressing how, when patients go on the internet, what do they see? Then how should we respond to them when they come back to us because they found information? And how should the provider be addressing the patient when they come to them? They find a new treatment on the internet. Who should be providing that advice? What guidance should we give them? Because so much information is out there, and the patients need tools now to be able to understand exactly what information to listen to and what to go back to their cancer, to the oncologist, to the health professionals to make sure that they are following the correct advice and they're following the correct information.
Yep. Well, Wendy, a lot of good information. I want to thank you for stopping by and enjoy the rest of the Congress.
Thank you very much.
Thank you.